Good afternoon. My name is Ala McCoy. I am Director of Startup Support at the University of Maryland's Ventures. I'd like to extend a warm welcome to everyone who joined us today for our next installment in Startup Fundamentals workshop series. This series is offered by Ventures with collaboration from Maryland Technology Enterprise Institute and Dingman Center for Entrepreneurship at the University of Maryland. Everyone attending the live session, please feel free to submit questions using the Q&A function of Zoom, and you can find it at the bottom of your screen. We are recording this session. It will be posted to our Startup UMD YouTube channel, and if you wish to do so, you can submit your questions anonymously. So today, we are joined by program directors from the National Cancer Institute's Small Business Innovation Research, or SBIR, Development Center. They will provide a detailed overview of funding opportunities and resources to help our biotech innovators at the University of Maryland and at the state of Maryland to move their projects toward commercialization. So thank you so much for joining us today. I'm very pleased to welcome today's speakers. Dr. Patricia Weber is a program director at the National Cancer Institute's SBIR Development Center. In her role, she provides oversight throughout the award period and mentors awardees in their technology goals and commercialization strategies. So welcome, Dr. Weber. And Dr. William Bozza joined the Small Business Innovation Research Development Center at the National Cancer Institute in January of 2021. He serves as a program director, managing a portfolio of oncology startups to facilitate small businesses in technology commercialization for cancer diagnostics and treatment. Thank you so much for spending your time with us today. Very much looking forward to hearing about the opportunities that our innovators and entrepreneurs can take advantage of. So SBIR is an integral part of startups, especially in the biotech arena. So again, thank you so much for sharing your knowledge. To everyone in our to all of the live attendees, please submit questions at the bottom of your screen, and they will be answered, I believe, at the end of the presentation, but please keep submitting them as soon as they pop up. So again, I'm gonna go ahead and turn off my mic and my camera off. The microphone is yours. Thank you so much, but I am here monitoring any questions.
Great. Thank you very much, Ala. I'm Patty Weber. She mentioned a program director in the SBIR Development Center. I'm starting my 16th year in the office, so I've been doing this for a while. I manage a broad portfolio that includes everything from therapeutics to digital health technologies. So we're going to split the talk up today. I'm going to give you more of the background on some funding opportunities. So we'll start out with about the SBIR and STTR programs. So there are 11 federal agencies that have SBIR programs, and as you can see highlighted in orange, the NIH falls under the Department of Health and Human Services. And at the NIH, there are 27 institutes and centers. The NCI is one of those, and it's highlighted in red. So those that are highlighted in the lighter orange color are those that have funding authority, and those in gray have no funding authority. These programs, SBIR and STTR, are congressionally mandated programs. And the SBIR is a set-aside program for small business concerns to engage in federal R&D with the potential for commercialization. And any federal agency that has an extramural R&D budget over $100 million has to set aside 3.2% of that budget for the SBIR program. The STTR program is a set aside to facilitate cooperative R&D between small business concerns in the U.S. and U.S. research institutions with the potential for commercialization. And federal agencies with an extramural R&D budget over $1 billion must set aside 0.45% of their budget. And that column on the far right represents the set aside amounts for fiscal year 22. And so for that year, NCI alone had $192 million for these programs. There are some critical differences between SBIR and STTR. As you can see, SBIR permits research institution partners, for example, universities. But on the other hand, their STTR program requires that the small business partner with a research institution. On the SBIR side, the small business may outsource up to 33% of the phase 1 activities and up to 50% in phase 2. And in terms of the STTR program and division of labor, at least 50% of the 40% of the work should be conducted by the small business. This is the for-profit small business, and a minimum of 30% by the U.S. Research institution or nonprofit. In regards to the PI involvement, on the SBIR side, the PI must have their primary employment with the small business. On the STTR side, the PI's primary employment is not stipulated, so they can be a full-time university employee, but they must devote a minimum of 10% of their effort to the project. So the important point from this slide is the award is always made to the small business concerned. So the small business is the applicant and the recipient of the award, whether it's SBIR or STTR. In regards to eligibility, I think you need to back up one slide. So again, as I said, the small business is always the applicant, and they must be organized for profit and based in the U.S., and the work must be performed in the U.S. 500 or fewer employees is what is considered a small business. I will say that most of our applicants are much, much smaller than that, typically 20 or less. In regards to ownership, so greater than 50% U.S. owned by individuals and independently operated, or greater than 50% owned and controlled by another single business concern. That is greater than 50% owned and controlled by one or more individuals. There is a VC component allowed for the SBIR program only, where it can be, the company can be more than 50% owned by multiple venture capital operating companies, hedge funds, private equity firms, or any combination of these. But again, the award is always made to the small business concern. The SBIR and STTR programs are 3 phases. So the first phase is phase 1, and this is intended to fund a proof of concept or feasibility. At NCI, we allow a budget up to $400,000, and the project period is typically 6 to 12 months. And that's followed by a phase 2 application that's intended to fund further research and development. This application does require a commercialization plan, and the NCI allows up to $2 million over 2 years. There's also what's called a fast track application, where you can combine phase 1 and phase 2 projects into a single application. And there's also, for the SBIR program only, what's called a direct to phase 2. And then following that, under the SBIR program, there's a phase 2B, or we call it at NCI a bridge award, and it's intended to fund the work needed to cross the valley of death before you get to full commercialization. And it's intended to fund additional technology validation, maybe clinical translation. And it's a follow-on funding for phase 2 awardees from any federal agency. So you can come to the NCI if you've been funded by NSF or even or another NIH institute, as long as your project is cancer focused. And we do expect that applicants will secure substantial third-party investor funds. And for this award, we allow up to $4.5 million over 2 to 3 years. And the final phase is phase 3. That's the commercialization stage, where there's no SBIR or STTR funds involved. So the budget limits, as you will see in the solicitation, it'll often say that the standard award amount for a phase 1 is $150,000, phase 2 $1 million. Congress has recently raised the hard cap for a phase 1 to $306,872, and phase 2 to $2.045 million and a little bit more. But at NCI, we have capped our phase 1s at $400,000, and phase 2 remains at $2 million, but you are allowed to request an additional $50,000 for technical and business assistance. The waiver caps are institute specific, so what's listed here on this slide is for the National Cancer Institute only. We've provided a list here to the waiver topics in this link. Here are the NCI waiver topics. They're pretty broad, includes all of the areas that we cover, from therapeutics, in vitro diagnostics, imaging technologies, devices for cancer therapy, agents for prevention, low-cost technologies for low-resource settings, and cancer global health. And the last of development of digital health tools is a very broad waiver topic. We cover everything from an app development to a software tool that could connect providers with caregivers. You know, just you name it, digital health tools, we cover pretty much the whole spectrum. So this slide shows you, the highlight here is really that SBIR, STTR grants are intended to fund product-focused science, as opposed to an academic grant, which is really intended to fund the basic science. Not that innovation on the academic side isn't important, but it's really important on the SBIR, STTR side. And then the ultimate goal for the SBIR, STTR grant is commercialization. So why would you want to seek SBIR funding? This funding provides seed funding for innovative technology development. It is not a loan. No repayment is required. It won't impact your stock or shares in any way. It's fully non-dilutive. The intellectual property rights are retained by the small business. NIH does not request intellectual property for the SBIR, STTR funded technologies. We think that this provides recognition, verification, and visibility for your technology, because every application is rigorously assessed by the NIH peer review system. And in our experience, it has helped to provide leverage in attracting additional funding or support. In addition to funding, we also provide commercialization resources to help advance your project. And Billy's going to talk more about that later. This slide shows you NCI's SBIR funded portfolio. You can see how broad it is, and that the largest section of our portfolio is therapeutics, and that includes biologics and small molecules, and that's followed by in vitro diagnostics. But you can see here we cover the gamut. So what are some of our core activities in the office? Well, we provide scientific technical portfolio management, but we also provide advice on application submission and resubmission guidance. We develop and manage funding opportunities. We provide commercialization assistance initiatives, training and mentoring. So we really try to cover a broad range of activities to support applicants as well as companies in our portfolio. I'm going to cover a few of the funding opportunities in the next few slides. So the main funding opportunity announcement is called the Omnibus Solicitation. And the numbers are here in the column under SBIR FOA and STTR FOA. And the receipt dates for the Omnibus are April 5th, September 5th, January 5th every year. We also have some notice of special interest. These are called NOCs. There's one for RNA delivery technologies. There's one on utilization of cohorts and prospective study designs for liquid biopsy assay for detection of early cancers. We've got one for SBIR technology transfer, and this is to bring technologies that have been developed at the National Cancer Institute. There's one for single molecule protein sequencing. And Billy's going to talk about some of these other opportunities in a little bit more detail. So the Omnibus Solicitation, as I mentioned, this is the standard application announcement, funding announcement, where most of our applications come into the NCI is through this funding opportunity. So it allows new phase 1 fast tracks, a resubmission for all phases, and direct to phase 2, only SBIR allowed. And we welcome you to send a specific aims page to the email shown here on the slide, ncisbir@mail.nih.gov. And we'll help you set up a call with one of the program directors in the office to help you work through that aims page so that you're planning to request an appropriate scope application for a phase 1, fast track, or a direct to phase 2. And we encourage applications for any topic within the NIH mission. And so this is not just for the National Cancer Institute, but any of the NIH institutes. At the NCI, we also offer research and development contracts. So there's a little bit of a difference between grants and contracts. As I mentioned, the omnibus solicitation is investigator initiated. So you come up with the idea of a technology that fits within the mission of either the NCI or one of the other participating institutes. So 3 receipt dates, as I mentioned, and then we've got the targeted solicitations under the grant side. Now on the contract side, we have specific topics that are NCI priority areas that have a strong potential for commercial success, and it involves significant NCI oversight. And there is only one receipt date for the contract solicitation. There's a link here in this slide that you can find some examples of previous R&D contract topics. The next publication date will come in July of this year, and the receipt date will be sometime in October of this year. Another little bit of a difference between grants and contracts in terms of scope. As I mentioned, on the grant side, if it's omnibus, investigator defined within the mission. If it's contracts, it's defined by the NIH, and these are more focused. And then the peer review for grants comes in under the Center for Scientific Review. At the NCI, we have a division that manages a peer review, and we do spend a good amount of effort to get 50% of our reviewers coming from the business community. If you have questions regarding a grant solicitation, you may speak with a program officer. On the contract side, you must reach out to the contracting officer, and their name is always listed in the solicitation for each of the participating institutes on that contract solicitation. The receipt dates, again, 3 times a year for the omnibus and only once a year for contracts. And are there set aside funds for particular areas? That's a no on the grant side, but yes for the contracts. And then the basis for the award is based on the peer review score for the grant side. But on the contract side, if the proposal scores well during peer review, then the NIH can negotiate with the offerer to finalize the deliverables. And then on the reporting side, you have one final report for phase 1s on the grant side and annual reports for phase 2. Contracts, there's a little bit more reporting involved. There's a kickoff presentation, quarterly progress reports, a final report, and usually there's an end of contract presentation with the contractees. This slide, I just wanted to show you an example. These are contract topics that were published last year and are undergoing peer review now, just to give you an idea of what some of our topics have been, but they do change every year. Sometimes a topic will be resolicited. So a little bit about the Small Business Transition Grant for Early Career Scientists. This is a entrepreneurial training grant that was modeled after the K99 and R00 grant series. It has an academic investigator path. That's what the K99 involves, and you move on to tenured faculty. In our office, we call this is grant opportunity. It's called the Small Business Transition Grant, and it brings you into the R41, R42, which is the STTR mechanism, R43, R44, SBIR. So how does this grant opportunity work? It starts as a phase 1 STTR, involves training. So the small business concern, the PI is usually a postdoc. There's got to be a mentoring plan, and it's required. It includes a technical and a business mentor. And then on the technical side, the PI prepares the technology to move to a small business concern. You must participate in the I-Corps program, budgets up to $400,000 for 12 months. And during the transition period, so this is a fast track, the PI moves to the small business concern. And then in the phase 2, it's an SBIR, same PI, mentoring continues. And then most of the research is conducted at the small business. And then we obviously allow small pivots because of having gone through the I-Corps in phase 1. And the budget here is $2 million for the phase 2 for 2 years. And then we have 2024, we'll have again the concept award. This is a contract opportunity. We allow funding up to $300,000, and it's intended to fund high-risk, high-reward projects that focus on the innovation, intended to fund disruptive technologies to address rare and pediatric cancer. These are shorter applications for a contract. They're 20 pages versus 50, have special review criteria. We fund experiments to de-risk early-stage technology, and we make these awards rapidly within 6 months. And the awardees, again, are intended to enroll in the I-Corps program. So there will be some due dates coming up this year, white paper in May and full proposals in August. And the Bridge Award, I spoke a little bit about this one, but it allows for $4.5 million in additional funding over 2 to 3 years. It's a follow-on to a phase 2 award. So it's again open to phase 2 awardees from any federal agency with projects relevant to the NCI mission. It's very competitive. We will have an announcement coming in July. The next receipt date will be in August of this year. So the funding opportunity has not been published yet. And I'm going to turn it over to my colleague, Dr. Bozza.
Thanks, Patty. Thanks, everyone. Really excited to be here and go over 2 different things in my portion of the talk. Talk about some non-funding assistance and initiatives, and then tips for application. I want to be a little cognizant of time, so I may skim through some of the non-funding resources that are focused on the awardee side, as my understanding is the majority of the audience is on the applicant side, just so we have enough time for questions at the end. So this is a high-level big picture of all of our non-funding resources, and they're kind of broken down by applicant versus awardee options and different phases within the SBIR program. So things that are shaded in dark red are open to applicants. Things that are shaded in the lighter pink color are really kind of meant for awardees. But I'll still run through some of these in brief, just to kind of highlight all the different great resources that are available at NCI SBIR and some kind of encouragement to apply and get that award. So the first is the Applicant Assistance Program. We call it AAP. So this is, of course, on the applicant side. It's free to apply and free to take part in the program. If you are taken into the program, you work with the contractor. Currently, that contractor is Eva Garland Consulting. And it's really meant for companies who have not had a previous SBIR award and kind of need some help in terms of grantsmanship. So it's a grant coaching process, and it's aligned with the different omnibus receipt dates throughout the year, so January, April, and September cohorts. Another option and resource that's open on the applicant side is our webinar series called PLAN. It stands for Peer Learning and Networking. High-level big picture is the goal is for NCI SBIR companies, both applicants and awardees, to hear best practices from other companies and other folks that have gone through our program and been very successful in the related webinar topic. The topics are pretty broad. Some of them are focused on how to be successful in applying, such as how to write a good specific aims page. And we have other more technical topics, such as keys to a successful IND filing, implementing a quality management system, and also some that are kind of focused on startup and entrepreneurial development, such as first steps for starting a small business. So the webinar series is a 2-part kind of program. The first part, we ask our panelists to record short 5 to 10 minute video recordings of the content. So then when we start to promote the outreach for the second part of the webinar, which is a live 1-hour Q&A session, the audience can kind of digest that material, watch it at their own pace, and generate good questions that they can then come and ask in real time for part 2 of the session. We typically do about 3 of these per year. So, follow us. There'll be some information at the end of the talk, and get on our kind of email list and be privy to some of this information. It's also on our webpage at all times too. Another great program, we're going to transition. Most of this is on the awardee side moving forward. And I'm going to just focus on a couple high-level ones that I think are, really the most interesting and most benefit for companies that are just getting started. So we have the I-Corp program at NIH. This is an entrepreneurial immersion course. The goal is really for companies to refine their business proposition, and it's created through experiential learning. So companies are required to go out and conduct at least 100 interviews over an 8-week period of time. They form a 3-member team consisting of the principal investigator, an industry expert, and a C-level executive officer within the company that has decision-making authority. And they go out and conduct these interviews, and it's really quite powerful. Another great program that we run is something called the Investor Initiatives. So here our awardees are able to apply to the program. It's a short, I think around 10-page application that's reviewed by our network of big pharma folks and folks in the venture firms. And so at minimum, all of our companies get written feedback on certain gaps and things they should be focusing on moving forward as they try to drive their technology towards commercialization. And then companies that are selected are given funds to go out to the best conferences in the country and are given pitch coaching to make sure that pitch, really results in something beneficial to the company. And we've had a lot of great use cases and examples where these type of opportunities have led to funding opportunities. We have a lot of great programs, but another really great program, again, on the awardee side, is a program called CARE. It stands for Connecting Awardees with Regulatory Experts. So here our companies get early access to FDA regulators, so they can submit written questions and get written back from all the major centers within FDA, SBIR, CDER, and CDRH, for example. We have a lot of mentoring programs. This one is called IMAP, where potentially we have a company that has a really cool, innovative technology, but perhaps they're a little bit junior on the commercialization side. So we kind of match them up with people in our network that are seasoned serial entrepreneurs that really have a good handle on clinical and commercial translation. I think I can skip executive roundtable. TABA is something that is important to highlight. Patty mentioned it briefly. There's a couple flavors of TABA. There's TABA funding, and then what I'll just call TABA resources. So TABA funding is the simplest to understand. At the time of submitting your SBIR or STTR application, you can request an additional funding over those max budget amounts that Patty went through. For phase 1, it's $6,500, and for phase 2, it's $50,000. And these are for non-R&D type activities. So companies usually use it for help with IP filing or consultation with regulatory experts. If you click on that link, you can see all the different things that qualify for TABA funding. On the flip side, and it's one or the other. So if you don't request the funding, then you can wait till you become an awardee and apply for some of the TABA resources that are on the right hand of this slide. And that's, again, is divided by SBIR phases, phase 1 and phase 2. For phase 1, companies are able to apply for something called the TABA needs assessment, which essentially is a gap analysis report of several different important entrepreneurial criteria, such as market needs, IP, business profitability, manufacturing, regulatory, et cetera. And there, what you get out of it is a written report really detailing what you need to be focused and moving on as you move forward in product development. And then the goal is really when you become a phase 2 awardee, you can leverage TABA consulting services. And whatever that gap is, you can get an additional support from a contractor identified by NIH to tackle whatever that unmet need is. This slide is to kind of help facilitate further interactions after this outreach ends. Patty mentioned we do a lot of calls for specific games feedback to make sure companies are applying to the right funding opportunity. So you can always reach out at our office level email box and get paired up with the program director. I'd encourage you all to sign up to our e-newsletter to make sure you're up to date on all of our newest things. Things like the planned webinar series is always advertised in that mechanism. Follow us on social media. There's also a link at the very far right of this slide where you can sign up for our monthly office hours. So I'd encourage you to do so if you have questions about the program that aren't able to be answered for whatever reason during this outreach. Okay, I think we're moving good on time. Getting started. So these are, tips for applying. I think some of these we can kind of skim through here. Yeah, so first things for getting started, there's a document called the SF424. So this is a very large, over 100-page PDF document, but it has really all the information for how to successfully apply for the SBIR program and a lot of good policy information. We're going to talk about on a coming slide the NIH Project Reporter. This is a web-based tool to see what NIH has previously funded, so get a good idea of how innovative your technology is, if it's within scope of things that NIH has funded. The third check mark there, you can look at sample applications. So we have a curated list of actual applications that have been funded. So it's a good way to understand kind of size requirements, amount of detail, and ways to organize your application. And the last check mark, we already mentioned the plan videos, but two in particular, and this although previously recorded and past webinars, you can access all this information at any time. So really helpful on how to write a good specific games page and first steps for starting a small business. So if you're new, you're starting up a new company, you're getting ready to apply, I would definitely recommend checking out those videos. Okay, so this slide is devoted to the NIH Project Reporter. Again, this is a web-based tool, so you enter specific text related to your technology, and you can actually, under the Advanced Setting tab, you can filter it by institute, SBIR mechanism, to really get a good sense of previous NIH funding history by institute and by funding mechanism. Another really cool component of Project Reporter is something called NIH Matchmaker. It's within that same kind of web links there. And you can enter a little bit more information. You can, in fact, just copy and paste your abstract, and it'll identify several things for you. The best institute within NIH to receive the application, and the best study section that should really be reviewing it. Now, ultimately, NIH and the Center for Scientific Review make that call. But using the PHS assignment request form, when you submit your application, you can really highlight what you think the best institute and study section is. And that does play a part in the decision-making process. Also with Matchmaker, you can identify similar projects, like we mentioned, that have been funded previously, and also program directors who manage a similar portfolio. So if you want to reach out to a specific PD that manages some similar technologies, it's a good avenue to kind of identify who that person is. This is another tool. It's called ART, Assisted Referral Tool, very similar to Matchmaker, but it's on the CSR, Center for Scientific Review side. So just another way to kind of identify the best study sections. Special emphasis panels are what we call them for SBIR, but essentially study sections. Patty had an earlier and better slide of this. I just want to highlight we're a centralized core at NCI SBIR. So all of our program directors were only working on SBIR, and that allows us to do a lot more with our time. Really highlighting that you should reach out, connect with us if you're interested in the SBIR program. On our contact webpage, you can see all of our different program directors. So find someone that has a similar subject matter expertise that's aligned with your technology and reach out to us. That's our biggest message for today. Okay, now let's go through application tips. So first, what is NCI looking for, and specifically NCI SBIR? And I always like to highlight two things. So for NCI and NCI SBIR, innovation is our bread and butter. So the more innovative your technology, that's going to have a really good impact in peer review and within programmatic decision making. The second component of that is there really has to be this significant commercial potential. There has to be an ability to take that technology and to drive it and to translate it into a commercial product. That's a lot different than the R01s and the R21s of the world. We're not looking for advancement of knowledge gain. It really has to be, all built in towards product development and making sure there's a need for a commercial product to be developed in that space. So tip number one sounds simple, start early, but every year companies miss the receipt dates. I should say every cycle companies miss the receipt dates. It takes time to refine your product, to make sure you have all the available expertise on your team, the equipment, facilities, and resources. Obtaining letters of support are critical. That takes time. Also, you need to have all of your small business registrations in a row. Sometimes those lapse, and it takes a day or two to get activated, and ERA Commons won't let you submit your application until all those things are finalized. So always a good idea to start, I'd say, at least a week in advance. Since you have the slides, this is the different registrations you need for your small business. Product vision. So I always encourage my companies when they get ready to apply and when they become an awardee, go out and do your own small scale I-Core, do your own customer discovery. Make sure you understand that there's really a true commercial need, there's a clinical unmet need that your technology can address, and there's a market for it. Seek help with others. Is your team strong on the grantsmanship side? If not, do you have people in your network that are previous SBIR awardees, or even folks on the academic side? Having good R01 or R21 experience really translates in terms of grantsmanship. Tip number 3, know the different application components. So we've mentioned this a couple times now, specific aims page. So I really want to make it clear. This is one page within the application, but it's to serve as a high-level overview of the technology. And you want all of your best information to really be on the specific aims page. And the reason for that, your application will be signed an initial 3 peer reviewers, and they'll give you a preliminary score. If that score is within the top 50%, your application will be discussed in the study section, and there'll be another 20 or so reviewers that will then score your application. Now, everyone is supposed to read all the applications in advance, but during the actual study section, everyone will be listening to the discussion of the initial 3 assigned reviewers and skimming through. And because this is a high-level summary, again, you want all of your best information to be on this page, and we found that reviewers frequently land on this page. And we give guidance and we set up calls. So this is the information that we request to have those one-on-one calls with program directors, is develop this specific aims page and get some feedback from the PDs. And we also have a guidance document on how to structure this information. So the first half kind of serves as background. Always critical, first few sentences should clearly highlight what the product is. And you want to go from there. You want to highlight what the cancer indication is, what the current clinical unmet need is, why your technology is ideally suited to address it. You really want to highlight the innovation of your technology, making it clear how you stand out with potential competitors. A couple sentences going over the stage of development, giving kind of a high-level summary of the best preliminary data so people really understand where the technology currently sits. And then the second half are your actual aims or objectives that would be worked on within the grant. So it's always critical to use goal-based statements, describe key assays and model, and to include quantitative milestones so NCI can determine success for each aim or objective. The research strategy section is another critical component of the application. This is essentially the scientific meat of the application, and it's organized and structured quite similar to the specific aims page, just a lot more information. So for phase 1, the section is about six pages, and for phase 2, somewhere between 10 to 12 pages. Something I always recommend my companies to, in addition to all the other kind of components we discussed for this on the specific aim side, is to include a timeline or Gantt chart. So you want peer reviewers to be convinced that the work being proposed can be completed within the performance project period. So kind of indicating a timeline with the different aims and indicating you have the different resources and expertise on the team to complete that is something that typically scores well on peer review. These are other sections of the application. We're not going to spend too much time here, but just high-level information. Biosketches should be included for all key personnel, really highlighting how they have the expertise to be involved in the project. You want to be clear in the facilities section. You have all the different equipment and resources to complete the aims or objectives proposed in the grant. There'll be a whole section devoted to budget. Title and abstract, self-explanatory, but critical. This is actually the information that CSR, Center for Scientific Review, uses to make the determination which institute and study section will receive the application. If there's human or animal studies involved in your application, you'll have these information submitted in different areas within the application. For phase 2 applications, there's a whole section devoted to commercialization, so that's quite important. and letters of support, again, from key opinion leaders or venture firms, people that are interested in this type of technology. All of that can really help boost significant scores in peer review. Okay, tip number 4, understand the peer review process. Again, we mentioned this, the application is submitted to NIH, and then the Center for Scientific Review makes the determination where the application goes and which institute receives it. We talked about the study sections and the PHS assignment request form to make recommendations for specific study sections. And there's a link there. And the best way to get experience is to volunteer your time as a peer reviewer. And we frankly always need good help in this area. So these are the different individual criterion scores. So they'll be on your summary statement, and these are things that you should kind of tackle and address when building your application. Significance, innovation, approach, investigator, and environment. Commercialization is not individually scored, but should really encompass the whole application as well. So after peer review happens, you'll receive a summary statement, usually about 30 days after the peer review date. And on the top left will be your program director with his or her contact information. So you should definitely reach out to them especially within NCI SBIR, and set up a call to go over these comments and tips for resubmission if needed. The other big thing to pay attention to is the impact score. So that score has a kind of direct influence with chance of actual funding. So, and for NIH, the lower the score, the better. So things less than 20 have a good shot at funding. Within the summary statement, there'll be usually three different critique or reviewer comments, and then it'll list each of the individual criterion scores. And again, the lower the better. So things like 1s or 2s are really important. And on the flip side, things that score higher are things that you should really focus on in addressing for your resubmission. In the very end of the summary statement will be a list of the different members of the peer review. This is the second to last tip. Know the common pitfalls. Potentially the reviewers didn't understand your proposal. So try to improve your presentation. Get someone within your network to take a look with a fresh pair of eyes, as long as it doesn't compromise your IP. Make sure you're presenting key data in the application, not just referencing it in publication. The best data should be generated and included as figures. Reviewers did not think your technology is significant. So try to understand where the comment is coming from, their point of view, potentially their background. Try to address those comments in an evidence-based fashion. Always try to be specific and quantitative, and when you can add data to support your claim, that's of course a huge plus. The other big thing for significance is letters of support from key stakeholders and key opinion leaders. That's really a good way to kind of boost significance, in my opinion. Sometimes reviewers miss things. So for certain information, it's essential to include it in several portions of the proposals. A good example of that is if there's animal studies, including that experimental detail for the animal work, not only in the vertebrate animal section, but also in the research strategy section. Tip number 5, continuing on that, low score for investigators. So one of two things is you need to strengthen the expertise of your existing team, go out and recruit them as either consultants, make sure their biosketches are included. You can pay them on the grant if you need to. Another version of that is you do have all the expertise and you just need to strengthen the actual biosketches and make sure that that's clear. You can also, this is something I recommend, again, a management plan strategy where you indicate each of your aims or objectives and who's working on them, their expertise related to their project and their commitment to it. This is the last tip, and then we can jump into questions. To be resilient. So it's definitely a competitive program. You can see success rates for each fiscal year going back, and it's around 10% for original submissions. But having the resubmission process, so having the ability to take in reviewer comments and address them in a positive way, hopefully alongside with your program director, really boosts your chance of success. And resubmission rates typically, depending on fiscal year, increase about 2 to 3-fold. So again, big picture message, talk to your program director, especially when you have your summary statement. Thank you. This is our office level phone number and email contact. And I'm going to stop sharing and we can take some questions.
Bailey, I see a question that came through, you can answer this one. Why is NCI opting to use a contract instrument instead of an assistance instrument for the Future Concept Award?
Okay, so I caught concept award. Can you repeat that one more time, Patty?
Yes, they're wondering why we've chosen to use the contract mechanism instead of the grant mechanism for the concept award.
Yeah, so for this, it's actually quite critical to use the contract mechanism. So this is a program I've run. It's really great. There's a really high bar and focus on innovation and then, rare and pediatric cancers. So something we built into the process is a white paper review. So if we really want to solicit and receive the most innovative projects, we need to receive usually a high number of them. And to make that kind of possible on the peer review side, we conduct our own internal white paper review at NCI with just NIH and NCI experts and staff. And so that kind of allows us to give quick feedback to the companies whether or not we think this is within scope of concept award. So that really essentially creates a manageable peer review. The peer review also then happens at NCI level as opposed to within CSR. So that allows us to kind of get a custom tailored peer review that's focused on early stage innovation. Also, addressing the focus of rare and pediatric cancer. And in general, as Patty mentioned, this is our special program, and we feel there needs to be a higher level of oversight on the programmatic staff. So this contract mechanism allows us to achieve that. Okay.
Great, thank you. I see another question here. I can probably take this one. It says, I'm fairly familiar with NSF's I-Core hubs and national I-Core teams programs. Is NIH's I-Core program similar? I will say yes. It was really modeled after NSF's I-Core program. I'm sure there are some maybe specifics to NIH, but it's a great program. We always encourage our phase 1 awardees to participate in I-Core because through our experience and through NSF's experience, it really helps those companies to come back with a stronger phase 2 proposal because you really understand the market for your technology or your product. If you want to add anything, Billy, feel free.
No, that sounds great.
I do have a follow-up question to that. So so in College Park, we are an NSF I-Core node. So we run regional I-Core program. And for the PIs to qualify for national I-Core program, they either have to have NSF lineage, meaning their research has to be sponsored by NSF, or they first have to go through the 2-week regional program that would create that lineage. What are the qualifications for the NIH I-Core? Do you have similar requirements?
I would say you need to have the existing award, the existing phase 1 award. So that's probably the biggest. There's a whole application component where really the things that we mainly look at, is there strong commitment from the company and the team. It's a big requirement, an 8-week program, a lot of interviews. So we would like to make sure there's kind of that strong commitment from the company. And also we look at the 3-member team. We want to make sure there's a strong industry expert, ideally someone that's a serial entrepreneur, a C-level executive, and then someone on the technical side. So I would say those are the major things, right? And then we'll take into consideration somewhat the parent award, that project, and as long as there's no major red flags there, that's the other thing we kind of look at.
Got it. So there's no requirement that the technology they are commercializing has to be originally sponsored by NIH or NCI.
It should be, right, Patty? It should be tied to the parent award, and that parent award, is what NIH is funding.
Yes, I agree with that.
Okay, so there should be lineage. How do you look at applications or applicants, and does it matter in terms of success rates or preparedness if the team goes through the NSF I-Corps, either regional or national? Does it increase the chances for success in any way?
I would think it can't hurt at all. They've gone through the NSF program, already.
Yeah, the reason I'm asking is because we do have this 2-week program here, and we are encouraging everybody to go through that program before they apply for the national program. Right, we can take that offline too for further consideration. There is another question in the chat that I can read. Is there any regulatory support, for example, consulting, other than directly talking with the FDA?
I can take a stab at this one. So 2 things come to mind, right? Is TABA, that slide that we had on TABA, technical and business assistance. So you can, request funds directly for non-R&D activities, and regulatory consulting definitely fits within that scope or space. The other option is we have through the SEED office, entrepreneurs and residents, we call them EIRs. These folks typically have pretty good regulatory knowledge. So the way we're currently doing that is you'd have conversations, on the awardee side with your program director, raise your regulatory issue and kind of get their take or feedback if there's an EIR that might be able to kind of help and support.
Got it, thank you. Any other questions from the audience? If not, I can ask the next question. I'm very curious to learn about the IMAP, the mentor program. How is it available to applicants or those who consider? So what are the qualifications for people to access that program?
It's on the awardee side. And it used to be that you needed to complete a TABA needs assessment report first. And now I think the requirement is actually to partake in the investor initiative side. So it's a little bit downstream. So the first step would be getting the award and then kind of reaching with the program directors, maintaining like that good relationship. And there's, I think there is the requirement that it has to go through the investor initiatives program first.
Thank you. We do have another question from the audience. Do you receive many phase 2B applicants from other agencies, SBIR, STTR programs?
I can take this one. In my 16 years at the office, we have received a few. I would say that it's not the norm that a company that's received phase 2 funding from the NSF, for example, and that probably was the example is come in from a company funded through NSF. I don't recall seeing any that maybe were funded by DoD. Typically, it might have been a company funded from another NIH institute, but it does happen. But the majority of our phase 2B applications come in from companies that have been funded by the National Cancer Institute all the way from their phase 1 through their phase 2.
Yep, thank you. I have another question about the very fascinated by the transition program for the scientists to transition from the science to startups. So could you talk a little bit about that? What is the process? Who's eligible for that? And who do you see what does the successful applicant look like?
Want to take that one, Patty? Or
I'm looking at the Small Business Transition Grant page on our website, and if anyone wants to check that out, it's at sbir.cancer.gov, and under the Small Business Funding tab, you can go down to Small Business Transition Grant. And so we were really, again, looking for for projects coming out of the academic space that are really innovative. And we're looking to support, you know, young innovators and to transition this technology, you know, out of academia and into small business. So that's really the goal. That's why it starts as an STTR phase 1 and then transitions to SBIR phase 2. And certainly you can see that the mentoring requirement is really a key component of that, because it's not traditionally a factor in SBIR, STTR funding. So that's one of the things that's really looked at in reviewing these transition grant applications is, you know, how this junior academic scientist is going to be mentored to transition them into an entrepreneurial setting. So I do recommend, if you're interested in this program, my colleague, or our colleague, Saroj Rejni, is the person to reach out to, and he can talk to you a lot more about the program. And there's also a recording link on our website for an informational webinar that'll give you far more details than Billy and I are able to share today.
Yeah, that would be great. Maybe so after this workshop, I'll reach out to you and ask you for the slides. I've been asked by some of the attendees, and also maybe if we could provide that the link to some of the opportunities that you've mentioned, that would be fantastic. We do have quite a few young scientists who would like to transition, but it's you know, having this award and this type of support would be extremely important. So thank you. This is great to know.
Yeah, and I'll just add that we're definitely looking for more applications for this mechanism. So that's great that University of Maryland and your network has some folks interested in it.
Yes, thank you. And for those who are watching this on YouTube, please feel free to reach out either to me or to Patty or William directly with any questions. We can share the contact information. I don't see any more questions in the Q&A or chat. I would like to go ahead and thank you. Thank you so much, Patty, and thank you so much, William, for spending your valuable time and sharing your knowledge with us. This is, I learned a lot, certainly, and I have a lot of questions, but I would like to go first and visit all the links that you mentioned and read more, and maybe we can schedule a follow-up workshop, especially about the transition program, maybe with your colleague on how to transition and the support that's offered by the NCI.
Sounds great. Thanks so much for having us.
Thank
Yes,
you.
Appreciate it. You're most welcome. Take care, everyone.
Yeah, and thank you to everyone who tuned in and stayed to the end. Have a great rest of your day. Thank you.
I know.
Bye-bye.
Bye-bye.